Let's discuss interviewing, the stool form and color. Changes in the form of stool. The normal form of the stool is soft and moist with a long oblong shape. So we have here the table for the stool form. If it is dry stool with dark yellow color, it indicates heat in the intestine. If it is small round stool like that of a goat, it indicates a liver qi stagnation. If the stool is small, round, very dry, it indicates blood deficiency. If it is loose and shapeless, this indicates deficiency cold in spleen and stomach. If there is initial stool, if it is hard followed by a loose stool, it indicates dampness from spleen deficiency. If the stool is randomly alternating loose and dry stool, it is liver spleen disharmony. If it is a loose stool with visible undigested bits of food, it could be a kidney or spleen yang deficiency. If it is a stool with yellow mucus, it is damp heat in the large intestine. If the form of the stool is yellow, sticky, with putrid odor, it indicates a food stagnation. If it is a stool with pus and blood, it indicates dysentery. Now, next is the changes in the color of stool. Normal stool color is brown, but stool color is often affected by food and drugs, which would not otherwise suggest a pathology. For the color of the stool, if it is dark yellow, this indicates heat stagnation in the intestine. If it is black stool like tar, this indicates blood stasis or far bleeding in the upper GI. If it is red blood in stool, this could indicate hemorrhoids or near bleeding in the lower GI. If it is red blood with white pus in stool, it indicates dysentery resulting from damp heat in the large intestine. If the color of the stool is grayish, white stool, this indicates damp heat jaundice, steatorrhea. Next is the abnormal sensation during defecation. Under normal circumstances, defecation should occur easily and smoothly without any uncomfortable sensation. If the patient have abnormal sensation like unsmooth defecation, which has abdominal pain with defecation, incomplete sensation, this indicates either liver attacking spleen or damp heat in the intestine. For the pathogenesis, there is a qi flow in the intestine. The qi flow in the intestine is obstructed, does not transport the turbid downward. Next, if there is a burning sensation in anus during and immediately following defecation, this indicates damp heat in the large intestine, which is excessive heat in the stool. If there is tenesmus, it's a paroxysmal abdominal pain, frequent and urgent desire to defecate, difficult to completely discharge stool, small quantities fecal matter, heavy sensation in anus. This indicates dysentery due to damp heat, which is damp heat obstructs qi flow in intestine. Next, if there is a fecal incontinence, patient cannot control defecation, stool is discharged spontaneously. This indicates spleen yang deficiency or kidney yang deficiency. For the pathogenesis, it is a spleen and kidney deficiency cannot control muscles, most likely appearing in elderly patients with chronic diarrhea or chronic illness. If there's a sagging feeling in anus, patient feels something sagging from the inner body to the anus. In severe cases, prolapse of rectum can occur. This indicates spleen qi deficiency. So pathogenesis is spleen qi deficiency compromises its lifting function. Thank you for your attention.